กด subscribe ให้พวกเราด้วยนะคะ
Sawadee krap. Welcome to Tishidoko. Thanks for watching. Today we're going to be talking about healthcare in Canada, and specifically healthcare for newcomers, international students, temporary workers. If you're coming to Canada, how does healthcare work in Canada? But before we get into it, make sure to smack the like button, subscribe, share to your friends, let them know, turn on the notifications so you never miss a video from us. Across the world, Canada is kind of known for having free healthcare. But what that actually means is, as a Canadian people, we pay taxes which fund our healthcare system. So this is how our healthcare services are free. When we think of someone coming to Canada as a temporary worker, maybe working towards eventually permanent resident, the good news is, as a temporary worker, whatever job you have, you will be paying the same taxes as Canadians, income tax and some other taxes. So therefore, because you are paying these taxes, you have every right to get the services those taxes provide, like our healthcare. So as an international student, it's a little bit different. You still have access to our healthcare. Depending on the province you move to, you either get included at the basic provincial healthcare that we all have. However, some provinces require you to pay health insurance monthly to get access. Some have their own situations altogether. So it's a little mixed, but either way, your institution, your province, they'll be able to help set you up. Like I said, in Canada, all across the country, we have free tax-funded healthcare. And each province, it operates a little differently, but for the most part, it's the same. We all have, as Canadians, have a provincial health card. So in Saskatchewan, I have a Saskatchewan one. And even if I was in Ontario or British Columbia and I needed to go for an emergency to the emergency room, that health card would actually work all across the country. And the good news is it's similar to for temporary workers and students once you're on the healthcare plan at school. So, like I mentioned, the health card. One of the first things you should do before or when you get to Canada is whatever province you're going to, look up in their government website, the details about their health card access and how to apply. In Saskatchewan, you can apply online. You can easily call ahead or email ahead to communicate. I believe you'll need a Saskatchewan address when you apply because they will eventually mail you a physical card. And once you have this card gives you access to our healthcare. So what are the things covered by this basic provincial healthcare? So like I said, every province a little bit different, but the cards work across the country, and specifically we'll talk about what the main things the provincial health card in Saskatchewan covers. Number one, some prescriptions. So prescription drugs where you need a doctor's prescription in order to purchase it. The Saskatchewan health card will cover whether it's 100% of some prescriptions, it'll cover some amount of others. So it does help in paying prescription costs. It also covers doctor visits. So whether you go to make an appointment with a doctor, do a walk-in clinic, we'll get into details on that later. You have to go to the emergency room, stay in a hospital, you need a necessary surgery. Maybe these things aren't super likely in your situation, but that health card allows you to, when you get to that doctor's office, that emergency room, this health card will cover the costs. Nothing will have to come out of pocket. It does cover some other things, maybe not 100% coverage, but things like, mental health supports, stuff like this. And again, this is the same whether you're permanent resident, temporary worker, or Canadian. If you are working and paying taxes into our tax system in Canada, you get access to this healthcare benefit. Similar for international students. Again, different by province and institution, but just know that your institution will set you up such that you'll either have access to the basic provincial healthcare or you'll be maybe paying a fee which gives you that access plus more. So for instance, the University of Saskatchewan and Regina, I believe Regina, the two main universities in Saskatchewan, the University of Saskatchewan, for instance, as you come here as an international student, you'll get your provincial health card, but then part of your tuition, you'll also be paying a portion of extra health insurance and dental insurance. So this goes into what is not covered by the provincial health card. Number one, ambulance. So even though the emergency room visit is not covered, the ambulance system here is privately owned and it is covered by additional medical insurance like you would have maybe from the University of Saskatchewan or another insurance you purchase. Over-the-counter medications, so things like Tylenol, cough syrup, cough medicine, eye care, and dental. Those things are not covered by basic health coverage. If you are a working person coming as a temporary worker, it is very common for employers, regardless of the field, to have some basic extra coverage that it would either come off your paycheck or your employer would pay that. And that usually is dental coverage. Some have eye coverage as well and additional medical. You might be wondering, is it really that you don't pay anything if you go to the doctor's office? You don't have to give a credit card, a debit card, any cash. And really it's as simple as, okay, whether it's a walk-in clinic or a booked appointment, you really just, when you check in, you give your details and you give them your health card number. And this number is connected to the government, and that's how the doctors, the clinics get paid. So they know you're registered under that basic health plan in your province. And this is true whether if you're in Saskatchewan, you're traveling, maybe you're working here, but you travel to Alberta, Ontario, and let's say you got hurt or you had to go to the doctor's office. Same thing, even if it's another province, that health card, show them that. And actually the Alberta clinic will bill Saskatchewan, and regardless of the province, it's all kind of across the country. But each province manages their own systems. So I've mentioned a couple times walk-in clinic versus, a doctor's appointment. In Canada, it's very, common that people grow up having a family doctor. So these family doctors are general practitioners. They're kind of, the first line of defense. They do regular checkups, these types of things. And, growing up in Canada, it's kind of just, my parents used a family doctor and that became my family doctor. It's not a big deal though if you don't have a family doctor. Obviously, you're gonna be new to the country. If your plan is to stay long term, it's a good idea to maybe look at family doctors who are accepting new patients. You can do that online and try to book an initial appointment. And that's kind of how you go about getting a family doctor. But in the short term, all across Canada, there are also walk-in clinics. So these walk-in clinics, you don't necessarily book an appointment. You walk in, you kind of check in at the front desk, say, what your kind of symptoms are. And again, you give your information, your health card, and then you kind of just wait for the next available physician, doctor, who is also a general practitioner. So same as a family doctor, same background, but just sees people who don't have a family doctor. Another thing in Canada is specialist, and maybe this is not common for newcomers to need a specialist appointment for a surgery assessment or something like that. But the way it works in most parts of Canada is that you generally need kind of a referral from another frontline medical professional to have that referral to a specialist. You usually can't go to a specialist office and just say you want an appointment. You have to get that referral first. So this can actually come, again, from the family doctor, from a doctor at a walk-in clinic. Often even a dentist can give a referral if it has to do with oral surgery or something that the dentist is qualified to talk about. similar with an eye doctor. If there's a more detailed eye problem, they can give referrals. So all these more frontline practitioners can give referrals to the specialist. Emergency room probably works the same way as it does in Thailand. You know, if there is an emergency, and either if you need an ambulance or a friend gets you to an emergency, you kind of get just dropped off. They're all located at hospitals in different cities, and you just get checked in. And depending on the severity of your emergency, they kind of treat patients by severity. So if you're in serious risk, they'll swoop you in, they'll take care of you. It all works via the health card. So even if you don't give your health card information up front because it's an emergency, as long as you have it, they'll get that information later and there's no money to pay out of pocket. Say you went to the doctor's office, walk-in clinic, or you had an appointment and the doctor gave you a prescription. How do you get that medication from that prescription? Well, you would take it to a pharmacy. And pharmacies all across the country, you know, 3 big brands, London Drugs, Shoppers Drug Mart, Rexall pharmacies. Many grocery stores all across the country have their own pharmacies. Lots of local pharmacies, depending on the neighborhoods you live in. And you would take that prescription to any convenient pharmacy for you. You would go to the pharmacy counter and the pharmacist would fill that prescription and you'd get your medication that the doctor prescribed you. So pretty easy. Like I said, the health card, depending on the prescription, would pay 100% of the cost. Sometimes it's 80, sometimes it's 50, and you would pay that difference either out of pocket or from your employer extra health insurance or your school's extra health insurance, that might pay the rest. So there's a whole bunch of different scenarios, but that's generally how it works. One thing to note is that each pharmacy has their own dispensing fee, and this is a fee that the pharmacies charge just to cover some of their costs. And the reason I'm bringing this up is because some of those bigger national pharmacy brands, London Drugs, Shoppers, Rexall, they can have lower dispensing fees than maybe your local neighborhood pharmacy. So that's one thing to know. It's not going to be drastically different in price, but just so you're aware. Last but not least is something that doesn't have anything to do with your health card, but probably good to know, is the over-the-counter medications. You know, your Tylenol, Advil, cough medicine, allergy medication, these types of things that you can just purchase and you pay the money out of your own pocket. These things are not covered, by any health coverage. You can go in, pick up your stuff, pay out of pocket just like you would be going grocery shopping. These are pretty much the basics of getting started with the healthcare system in Canada as a newcomer. The good news is, depending on your situation, you likely have the same access to healthcare services as Canadians do. Please feel free to, ask any other further questions in the comments section. Let us know if this was helpful. Hopefully it was. We want to make it as easy for you as possible. And don't worry about writing comments or questions in Thai, because Tui will help me translate and respond. Thank you very much for watching. We do hope it's been helpful, and please let us know if there's any other topics you want us to discuss. Thanks again for watching. Please subscribe, Chop the Lemongrass. See you next time. Sawadee Krupp.